So very good afternoon to everybody. As was introduced, I am Pem Namgyal. I'm from Bhutan, but currently I work in the WHO regional office in Southeast Asia, which is located in Delhi, because people confuse between the country office of WHO and the regional office of WHO, because both are in Delhi. As was already introduced, Dr. Tedros was invited and would have very much liked to be here. Unfortunately, due to prior commitment, he is unable to do. Therefore, it is my honor and pleasure to speak on his behalf. I bring his greetings, and I also bring you the greetings of Dr. Poonam Khetarpal Singh, the Regional Director for WHO Southeast Asia region. Since this is a conference on patients, I was looking at what area of work WHO is focused on when we are talking about patients. And primarily our work with patients have been in the area of patient safety. So I'm going to talk a little bit about patient safety and what WHO has done in this. And then after that, a few other points. So Dr. Rajendra Pratap Gupta, founder of the International Patients Union, distinguished speakers, ladies and gentlemen, a very good afternoon to all of you. It has been a pleasure and a privilege to hear so many eminent speakers today on this important agenda of patients and their role in charting their future course of actions for their welfare and for their benefits. I congratulate Dr. Gupta and his able team for this event and for the change initiative of the International Patients Union. WHO, as the health technical agency, is of course involved very much with the issues around patients. And that focus, as I said, has been primarily around patient safety. WHO's work in patient safety goes back more than 20 years. It was the World Health Assembly in May 2002 that passed the resolution on quality of care, patient safety, which called upon the member states to pay attention to the issues of patient safety and asked WHO to take the lead in the development of technical norms and standards and to promote evidence-based policies for patient safety. It was in November 2003 that an international meeting took place in London, bringing together clinicians, experts, policymakers, and countries. One of the key outcomes of that meeting was a proposal to establish a World Alliance for Patient Safety. WHO launched the World Alliance for Patient Safety in 2004, and since then, WHO has facilitated the movement for patient safety through the establishment of global patient safety challenges. Such challenges identify a specific patient safety burden that poses a major risk to patients. Thus far, the following global patient safety challenges have been launched. In 2005, Clean Care is Safer Care, with the goal of reducing healthcare-associated infections by focusing on improved hand hygiene. In 2008, Safe Surgery Saves Lives, dedicated to reducing risks associated with surgery. And in 2017, Medication Without Harm, with the aim of reducing the level of severe avoidable harm related to medications globally by 50% over 5 years. At the same time, following the first WHO Patients for Patient Safety meeting in 2005, the Patients for Patient Safety, PFPS, network was created. Today, this network has over 250 members and spread across 52 countries. Guided by an advisory group made up of patients and with the secretariat at WHO Geneva, this network brings together patients, families, healthcare professionals, and policymakers to improve healthcare safety. It is a unique approach to engage and empower patients by sharing experiences and expertise to learn and to grow. Ladies and gentlemen, the World Health Assembly in May 2019 passed Resolution WHA 72.6, endorsing 17th September as World Patient Safety Day, to be observed worldwide to increase public awareness and engagement, enhance global understanding, and work towards global solidarity and action by member states to promote patient safety. The resolution while calling upon the member states to give patient safety high priority in health sector policies and programs, making it an essential component to strengthening healthcare system in order to achieve universal health coverage. Also, called upon the Director General to formulate a global patient safety action plan to be presented to the World Health Assembly in 2021. In response, the Secretariat presented the Global Action Plan on Patient Safety 2021 to 2030 to the World Health Assembly as requested in May 2021, and which was adopted by the member states unanimously. The observation of World Days is an important occasion for advocacy and awareness generation on specific diseases or health issues. Since the adoption of the World Patient Safety Day, the world has observed 17 September as World Patient Safety Day with the following themes. In 2020, the theme was Speak Up for Patient Safety. In 2021, it was Safe Maternal and Newborn Care. In 2022, it was Medication Safety. And for this year, 2023, the theme for World Safety Day is Engaging Patients for Patient Safety. In addition to the above actions by WHO, we also realize the importance of engaging with the highest policy-making levels in countries if any specific agenda is to find a place in the overall national development agenda. Therefore, with generous support from member states, WHO facilitated the organization of global ministerial summits on patient safety. The first such ministerial summit was held in London in 2016, then in Bonn in 2017. In 2018, it was in Tokyo, and in 2019 in Jeddah. The latest ministerial summit just concluded in February this year in Montreux in Switzerland. The ministerial summits on patient safety are important for raising awareness and driving the momentum of the global patient safety movement. Ladies and gentlemen, while I am talking about these global initiatives, I don't want you to think that nothing is happening at the regional or the country levels. In the WHO Southeast Asia region, that is in this region, the Regional Committee in 2006 passed a resolution on promoting patient safety in healthcare. A follow-up of this resolution was taken up at the next Regional Committee in 2007. WHO presented to the Regional Committee in 2016 a paper on patient safety contributing to sustainable universal health. Likewise, in other regions of WHO as well, they have taken many actions towards strengthening the policies and action in countries on patient safety. WHO alone cannot do all these. WHO closely works with members of our online global patient safety network, WHO collaborating centers for patient safety, NGOs in official and working relations with WHO to spread information, to share knowledge, and to advocate for improvement in patient safety. The Global Patient Safety Network is an online platform which is a repository of resources including adaptable strategies of low-cost intervention, best practices, and key lessons learned. This network aims to stimulate dialogue, promote continuous learning, and creates opportunities for contributing to improving patient safety globally, particularly for low and middle-income countries. The Global Patient Safety Collaborative, GPSE, is a strategic initiative established by the joint efforts of WHO and the government of UK and Northern Ireland, which recognizes the importance of patient safety as one of the critical components of healthcare delivery system, essential to progressing towards universal health coverage and achieving sustainable development goals. Likewise, in other regions, such as the Africa Patient Safety Initiative, is designed to be a strategic opportunity to build on the WHO resolution on global action on patient safety and to capitalize on the synergies and to provide a common platform to plan, to implement, or share experiences and initiatives in patient safety around the world. Besides these networks, WHO also has set up WHO collaborating centers in Italy, in Oman, Portugal, and Saudi Arabia. WHO collaborating centers are centers of excellence that work with WHO to advance specific agenda to generate knowledge that may find way into evidence-based policy settings. In similar ways, WHO also works with a host of non-state actors in official relation with WHO. Non-state actors or NGOs or INGOs are crucial for doing work that sometimes do not necessarily find room in national agenda setting processes. They are the voices of the people and therefore important in any areas as they form the bridge between policymakers, implementers, and the people. WHO works with many such entities. To cite a few examples, International Alliance for Patients Organizations or IAPO, International Hospitals Federation, International Society for Quality of Healthcare, World Medical Association, World Organization of Family Doctors, just to name a few. I'm sure there are many other national, regional, and global groups or associations who work in similar areas of work. And it is in this space that your International Patients Union fits in. I understand that the International Patients Union aims to connect patients across the country to doctors, policymakers, regulators, industry leaders, and what is more, patient to patient. A truly laudable aspiration, and I'm sure you can do much more with this. However, I may say that given the wide spectrum of health and illness, you may have to focus on disease groups or specific diseases which would benefit from such an organized entity in a meaningful way. Otherwise, you would risk spreading too thin your efforts and resources. What do I mean by this? Take, for example, diabetes, cancers, or autism spectrum diseases. These chronic or lifelong conditions have patient groups easily identifiable. They would certainly benefit from forming networks for support, for sharing information, generating knowledge, and therefore contributing to evidence-based policy and strategy development. If we take simply patients as a generic entity without any focus on what groups or types of patient, it would be too vast and too dispersed a target group to have any meaningful associations or interactions to yield useful results. I also understand that you have now an app that would facilitate your work. By the way, there is also a WHO app called MedSafe app, which is a mobile application on medication safety available for patients, their families, and caregivers. You can download it from Google Play Store or Apple App Store. Ladies and gentlemen, this brings us then to the world today where everything is moving to the internet, the digital superhighway. Tools such as mobile apps are a means to an end, and while we see their use, we must also acknowledge their limitations. Today, we are already talking about G6 spectrum and of artificial intelligence such as ChatGPT. Yet at the same time, there is a vast swathe of people who still do not have access to such facilities. Therefore, equity and access becomes important considerations if we are to truly reach the masses that would benefit from such endeavors and such technical advancements. I am sure you'd recall the images of children climbing up the hilltops or even up trees to get a signal to use their mobile phones when education moved online during the pandemic years. So while we are advancing so much in so many modern technologies, we must not forget there are millions who still cannot afford a mobile phone. For that matter, there are millions who still have no access to electricity or a telephone connection. I have heard so many interesting presentations, and the richness of the discourse and the wide variety of subjects discussed make me hopeful that knowledge and understanding of the need and issues are there. Ways and means to make use of technology and tools are understood. And what is more, the intent and the aspiration to reach out and help the vulnerable and the needy are there too. Therefore, I would like to say that WHO stands ready to work with you, and together we can help the patients to receive the care they need at the time they need, with the quality they need, and with the safety they need. Before I conclude, I would like to reflect on a personal thought. This morning, hearing Dr. Rastogi talk about empathy with patients, I was thinking, and I have thought about this for quite some time since I left medical college almost 40 years ago. I had the privilege of working in the best of institution in the world, that is All India Institute of Medical Sciences here in Delhi. But I did clinical work for less than 3 years. And since then, I have been in public health now almost 30 years plus. One of the things that I felt, and it was not a problem of All India Institute alone, but I think medical education in general in India and probably in our neighboring countries. And I felt that we produce very good diagnosticians. We produce medical doctors who are literally walking compendium of medical knowledge, information, and pharmacopoeia. One area where I felt we really lacked in our training and education was the art of doctor-patient relationship. And I've always told myself that if I were to go back to medical college, one area that I want to train is that. Probably I'm too old now to do that. But I think through a movement such as this, perhaps you could be the lever that can push the ball towards really putting into the curriculum of medical doctors training this aspect of the art of dealing with the patient. I think medical colleges, of course, had to follow the MCI guidance. But now that the MCI is gone, I think there is an opportunity that you could change. And I really think that this is crucial if we are to really achieve the patient-doctor relationship and the positive outcome that we're looking for through having patients be part of the process that we engage them in. And I hope that this would find some time, because when you look at the spectrum from the start of a disease till whatever end it may be, which may be cure or the end, the common element is the doctor and of course the nurse. And if the doctor and the patient relationship is on that positive keel, then I think half the battle on getting the patient the support and the care and the cure needed, I think is fought there. And I would like to end with this thought. And I want to thank Dr. Gupta and colleagues for giving me this opportunity to talk to you. Thank you very much.